And the other thing you want to talk about today as well is bones. And I don't think a lot of us know enough about our bones, to be honest with you. We always talk muscles and nutrition, but just explain why it's so important to keep your bones healthy and how you go about doing it.
Well, one thing that I'm going to start with definitely is oftentimes when people come to our office, or if I even line up with at the store or something, they say, oh, I've got arthritis, nothing can be done for me. And I literally feel like hitting my head against the wall, because I just hate to hear that. Because what arthritis is, I mean, there's different types of arthritis. Some of them are systemic disease, like rheumatoid arthritis or lupus. But your normal arthritis, and I go like this because there's nothing normal about that, is your abnormal wear and tear of your spine or your joints because of repetitive movement or abnormal alignment. Give you an example. You drive back and forth to Montreal with a car that is not aligned. Are you going to wear out your tires unevenly?
Of course.
Yeah. Same thing happens for the body. And why are we surprised of that? Still to this day, I don't know. I don't know why we're surprised.
So, Dr. Nathalie, are we able to then avoid the process altogether, or fix the process, or both?
It's a tough question to answer. There's so many components. There's heredity component that will come into play. But, you know, if you played a lot of contact sport, it probably made a huge impact. If you had an injury you never got corrected. You know, if let's say you hurt your low back or your knee, never went for therapy or anything like that, it changed your gait, now you're shifting. I mean, no offense, but last time you were like this, so I'd be curious to see what's happening there.
Right.
And that leads me to the point that if your spine is misaligned, or if you have a small shift, what do you think it does to the bone?
Obviously rubbing together.
Exactly. And the long-term process is called degeneration. Disc degeneration or osteoarthritis, that's what it is. And
so what you're in effect saying as well is you know, we might be in the progressive degeneration, but we can stop it from getting worse.
Very much so. Very much so. And or stop maybe a big word, because I mean age.
Or slow it down.
Slow it down, exactly. But tremendously slowing it down, and it's amazing. I put on if they don't mind taking the screen here. This is the neck. If we take the first one, so top right will be the neck seen from the side. So at the top we see the jaw and then the back of the head. So what I'm looking at here is I'm looking at the normal curve of the neck. And I joke with my patient that it's a lordosis, but I call it a banana. So if you've lost your banana, not your mind, but your banana, you're in trouble.
What if you've lost both?
Oh, so it's supposed to be
exactly. It's supposed to be like this. Okay, and we measured it. We measure it, and it's supposed to be 40 degrees. Okay.
All right.
Now in a phase 1 of degeneration, the one beside it, you can see it's much straighter. Now, any of you recognize themselves like this? You know, we work at the computer. Everything we do is forward. Then the second one is that's the one that you can start seeing the bone degeneration and the disc decay. And on the third one, you can really see the bone spurs and the degeneration. And oftentimes people will say, well, I'm 60 years old, I'm going to be in phase 3. No, it doesn't have to be that way. And I see it all the time that I've got some 60 years old come in my office and they're barely into a phase 1 because they kept a proper curvature, they took good care of their spine and posture and nervous system, and it's amazing the difference. Yet I have some football players that are 30 years old that are closer to a phase 2 or phase 3 because of all the hit that they've gotten. So again, age is a component, but it's not the major component. So there's a lot we can do ourselves.
Yeah, well, let's talk about chiropractic care in particular. So, you know, somebody's moving into a phase 2 or phase 3, they come to see you. What would you be doing for them?
Very good question.
Thank you very much. That's why they pay me to do this show.
Exactly. What is done in terms of decay. I cannot give people new disc, new bones. We can't. What we can help, like you said earlier, is to stop from progressing. But we can also help regain some of the curvature. And I give the analogy of braces. You know, you can change the alignment of the teeth in the long term, but we can do that. But the more advanced the person is, then the harder it becomes. So we can do something about that. And you have to think, and that's going to be my next slide, bones are one thing, but what's under those bones and sending signal in your body is what? The nerves, right? So let's look at this here.
Don't you feel like you're in school?
I know.
We're like, nerves.
I know. Okay, hopefully nobody has a sensitive stomach. This is a picture of a cadaver. Okay. So on the right side, we can see that nice banana shape. So nice cervical lordosis. On the next to it, you can see the brainstem and the spinal cord. Now, one day, I'm all for visual. I went to Home Depot and got the fellow to cut me a wire like this to show my patient the analogy of the nerve, the spinal cord. So if you look into it, there's tons of wires here. And that's no difference because all the tracks innervating the rest of our body is going through our spinal cord. Now, the phase 1 here, if they don't mind putting the slides up as well, we all agree this is a phase 1, right?
Yeah.
It's much straighter?
Yeah.
Okay. Now, on the other slide, you can see where the line is, that it's pointing at C5 and C6. And what do you see there?
C5 and C6.
I don't know, there's a little...
So I see a little
It's
mark.
pinched.
I was going to say,
It's pinched.
there's no room.
Exactly,
There's no
it's
room.
pinched. So that is pressure on the spinal cord, and you know nobody can think it's a good thing, right?
Right.
Now the point is, this person can be asymptomatic, have no symptoms at all. Maybe they're feeling tired, but you know what? They just turned 40 and they think, oh, it's the way I should feel.
Right.
But this can be putting pressure on tracks going to your thyroid, to your digestive system, and so forth. So that's why
it's essentially blocking some of the communication.
Exactly,
in your
you got
body.
it.
Okay.
Also, that pinch is creating a problem somewhere else in your body, which you
may
might not
be
even
pain.
think.
Exactly.
Oh my gosh.
Yeah. And that's what's so great about this, the technology that we've incorporated in our office, because I'm not guessing. I'm not a clairvoyant either to look at somebody and say, you know, your liver is not working necessarily well. So this technology allows us to give what we call a neurospinal function index, a number that the person has that take all these components and tell you how
sit up a
healthy.
little straighter.
I know,
here.
all of a sudden,
There we
okay,
go.
Dr. Nathalie, as always, like the amount that we learn from you is astonishing.
Yeah.
Like really, it's a wealth of knowledge. You're going to be continuing with us, and as I understand it, we're going to be talking about 10 steps to wellness, which include everything, right?
Yes,
Starting in your next visits.
Yeah.
Okay, well, thank you for giving us this background so far. We are going to look forward to the 10 steps, and I think we're going to be following them all. Look at how, look at how straight
See,
he's
all of a
sitting.
sudden.
It's gorgeous.
Except I got the shoulder thing. I
Yeah,
can
we're
see
going to
that.
sort that out, I have a feeling, next time. We'll be right back after this. We are actually, what are we doing there? We're having some music.
Yeah, we're going to introduce you to an Ottawa band.
Yeah, don't go away. We'll be right back after this. Thank you so much.